Good morning. My name's Alexia. I'm the GP in the clinic today. What's brought you here today?
Oh, hi, doctor. Yeah, I just thought I'd better get checked out because I've just been feeling a bit unwell recently.
Right, okay. Can you tell me a bit more about this unwellness that you've been feeling?
Yeah, I mean, I've been feeling really tired and a bit dizzy and really thirsty and also a bit breathless. And I don't know if it's related, but I've also got I feel quite itchy on my skin.
Right, okay. I'm really sorry to hear that. That sounds like quite a lot to be coping with while you're, working and everything. Um, can I just ask you a few general questions
Hmm.
about your health? Is that okay?
Yes.
All right. So, um, do you generally do exercise?
I mean, I've got a busy and stressful job, and
Right.
I just have three teenage kids as well, so I just don't have any
Okay.
time for exercise, you know?
Okay. That sounds like you're dealing with a lot and everything. Did so you mentioned that you had these symptoms. Was there anything that was particularly concerning you about these
Um,
symptoms?
well, I know I'm a little bit overweight as well, and there's
Okay.
been a lot of publicity about diabetes on the TV and the newspapers, and it's just, I mean, made me think that maybe I could have diabetes. So I thought I better get checked out. I mean, do these symptoms mean I might have diabetes, do you think?
So that's a very good question. Without a diagnosis, I really wouldn't like to say that it was diabetes.
Mhm.
Certainly those symptoms can relate to diabetes, but also it sounds like the lack of exercise, managing the teenage children, and having a stressful job could also be a reason why you're feeling like this.
Mm,
Um, so, um, so try not to worry at this stage.
mm.
If it's okay with you, I'd like to talk to you a little bit more about diabetes. But can I first ask, what do you know about diabetes? You said that you'd been seeing some things on TV about it.
Oh, I mean, not much really. I mean, I know obviously that it's something to do with if you like my symptoms, that's all I really know, like being
Right.
overweight, something to do with blood sugar or something like that. I'm not really sure. And I
Okay.
know there's type 1 and type 2, but I
Yes,
don't
that's right.
really know much about it, to be honest.
Okay, if it's okay with you, I'll give a very brief explanation of
Mm,
diabetes. So there are two types of diabetes. Type 1 is where insulin, which is a hormone in your body, isn't actually produced. And type 2 is where the insulin just isn't enough and it has to be balanced with either medication or so either tablets or maybe with injections if it's quite extreme. Um,
okay.
yeah, is that clear?
Yes, okay, yes. And so how would it be treated if I do have diabetes?
Right, another good question. I'll just briefly explain now because obviously you don't have a diagnosis. So, first of all, I'll just tell you a little bit about it. So,
Hmm.
it can be managed with medication, but it can also be managed with increasing your exercise, managing your diet and what you eat and when you eat, how much sleep you get. So, there's lots of things that we can discuss at a later date. Um, if it's okay for now, if it's okay with you, I'd like to just go through what we're going to do next in order to find out if you've got diabetes and then what we can do to help you if you have, and also what we can do to help you if you haven't, because obviously we'd like you to feel better no matter what.
Okay, yeah, that would be very helpful.
Okay, so first we're going to do a blood test, which I'll organise today, which will give us a clear diagnosis of whether you do have diabetes or not. When we get the results, we'll call you back to discuss with us. Is that clear so far?
Yes, yes, okay.
Okay, and then after that, we'll do an assessment of your health and your lifestyle, and we'll look at how we can help you either way, whether you have diabetes or you don't. Does that sound
Okay.
clear?
Yes, that's very helpful. So I'll do the blood test and then we'll discuss the results, I suppose.
Absolutely. So we'll do the blood test first, and then we'll go from there and look at how we can manage it better. So I'd like to give you a leaflet on diabetes and also on lifestyle changes. Is that okay?
Yes, that would be very helpful.
Great.
Thank you.